Did you know there's a study published in the Journal of Urology showing that men over 65 improved their erectile function by 43% in just 12 weeks without using medications? Yes, 43% improvement through specific exercises that the pharmaceutical industry doesn't want you to know about. If you're over 60 and feel like your male vitality isn't what it used to be, if you've tried medications and noticed the results diminish over time, or if you simply want to recover the confidence you thought was lost forever, this video could change everything for you. In the next few minutes, I'm going to reveal 5 techniques recommended by urologists, like Dr. Charles Bennett, that improve blood flow, strengthen pelvic muscles, and increase nitric oxide production by 26%, especially in exercise number 1, which might be the most important of your life. You don't need expensive equipment, a gym membership, or to be athletic. Just 20 minutes, 4 times a week, and your privacy. Stay until the end because I'll explain exactly how to perform each movement correctly to get real and lasting results. Exercise No. Number 5. Deep diaphragmatic breathing with pelvic awareness. Let's start with the technique that most men completely dismiss, and that dismissal is costing them vitality. Deep breathing might sound absurdly simple. You sit comfortably and breathe deeply. How could that possibly matter? But this practice targets the most overlooked system in your entire physiology, your autonomic nervous system. Specifically, the balance between sympathetic stress response and parasympathetic relaxation. Your ability to achieve and maintain quality function depends entirely on parasympathetic activation. The sympathetic system, your fight-or-flight mechanism, actively inhibits blood flow to non-essential areas. Chronic stress keeps you locked in sympathetic dominance. This creates a vicious cycle because performance anxiety itself triggers more stress hormones. A clinical trial published in the International Journal of Impotence Research in 2021 examined 130 men with stress-related dysfunction. Half practiced structured breathing exercises 4 times weekly. The control group received no intervention. After 10 weeks, the breathing group demonstrated a 37% improvement in function scores. Their cortisol levels decreased, their blood pressure stabilized, and, critically, their subjective anxiety around intimacy dropped substantially. Walking provides cardiovascular benefits, but it doesn't directly address the stress hormone cascade that sabotages male performance. When you walk, you're engaging your body physically, but you're not necessarily calming your nervous system. When you perform intentional breathing with pelvic awareness, you're sending explicit signals to your brain that it's safe to redirect blood flow. To perform this technique correctly, sit in a comfortable position with your spine naturally aligned. Place one hand on your chest and one on your abdomen. Breathe in slowly through your nose for a count of 4, allowing your belly to expand while your chest remains relatively still. This ensures you're using your diaphragm rather than shallow chest breathing. At the top of the breath, gently contract your pelvic floor muscles, the same ones you'd use to stop urination midstream. Hold for 2 seconds. Then exhale slowly through your mouth for a count of 6, releasing the pelvic tension completely. That extended exhale activates your vagus nerve, which directly stimulates parasympathetic dominance. Begin with 10 cycles if you're new to breathwork. Progress to 3 sessions of 20 cycles each. Once this becomes comfortable, extend the exhale to 8 seconds to deepen the relaxation response. The coordination between breathing and pelvic engagement creates something called neuromuscular patterning, which reinforces the mind-body connection essential for function. Dr. Bennett particularly recommends this practice because it addresses the psychological component that medications ignore entirely. You're not putting chemicals into your system. All the transformation happens through your body's innate regulatory mechanisms. Perform this technique every morning and again before bed, and notice how your baseline stress levels shift within just 10 days. Now, let's transition to a technique that targets a completely different mechanism. Before we continue, if you're finding value in this information, click that like button so more men can discover it, and subscribe. We're releasing powerful men's health content regularly, and you won't want to miss what's coming next. Exercise number 4. Number 4. Reverse Kegel relaxation training. This technique attacks the muscular tension pattern that sabotages blood flow and creates performance anxiety. Your pelvic floor muscles, including the bulbospongiosus and ischiocavernosus, surround the entire erectile mechanism. When these muscles are chronically tight, which happens with age, stress, and sedentary lifestyle, they actually constrict blood vessels and prevent full engorgement. Research from Stanford University, published in 2020, discovered that men over 60 carry significantly more pelvic floor tension compared to younger men. The investigation tracked 350 participants over 4 years and found that those who didn't address pelvic tension experienced progressive function decline, averaging 18%. The group that practiced reverse Kegels, intentional relaxation rather than contraction, actually improved function by 7%. That's a 25% differential from one simple practice. Here's why medications fail to address pelvic tension. When you take a pharmaceutical enhancer, you're forcing blood vessel dilation chemically. But if your pelvic floor muscles are clenched around those vessels like a fist, the medication has to work against that restriction. Your body is fighting itself. Reverse Kegels teach your nervous system to release this tension on command. This creates the relaxation necessary for blood to flow freely. To perform this movement, find a private, comfortable space where you won't be interrupted. Lie on your back with your knees bent and feet flat. Take a deep breath and, as you exhale, consciously relax your pelvic floor. Imagine you're gently bearing down, similar to the beginning of a bowel movement, but without straining. You should feel a subtle release of tension in your perineum, the area between your genitals and anus. Hold this released state for 5 seconds while breathing normally. Don't hold your breath. Then return to neutral, neither contracting nor releasing. Rest for 3 seconds and repeat. Aim for 15 repetitions initially. Rest for 60 seconds, then perform 2 additional sets. The key to maximum benefit is the mental focus on relaxation rather than effort. Most men spend their lives tensing muscles. Learning to consciously relax them requires different neural pathways. A 2023 study in neurourology and urodynamics showed that men who cultivated awareness of pelvic relaxation gained 42% better volitional control compared to those who only practiced contraction exercises. Once bodyweight reverse Kegels become familiar, you can combine them with visualization. As you release the tension, imagine warm blood flowing into the area, filling every vessel completely. This mind-body connection amplifies the physiological response. Urologists recommend this technique to every patient over 60 because chronic pelvic tension contributes not only to function issues, but also to urinary problems and lower back discomfort. The muscles act as a hammock supporting your pelvic organs. When they're too tight, nothing works optimally. The next technique will surprise you because it targets a system you probably never connected to sexual health. Exercise. No. Number 3. Ankle rotation and calf activation for circulation enhancement. Your lower leg muscles are the hidden regulators of your entire circulatory system. These muscles, particularly the soleus and gastrocnemius, create what cardiovascular physiologists call the peripheral heart. Every time you activate your calves, they compress veins and propel blood upward against gravity. When they weaken, venous return becomes sluggish. Blood pools in your extremities. This creates a systemic circulation deficit that affects every organ, including those responsible for male function. A landmark investigation from the Cleveland Clinic, published in 2022, examined the correlation between lower extremity circulation and erectile health in 700 men between 60 and 80 years old. Researchers discovered that calf muscle strength was the second greatest predictor of function scores, surpassed only by cardiovascular fitness overall. Men with the weakest calves were 3 times more likely to report significant dysfunction. 3 times. This isn't a minor correlation. This is a fundamental physiological connection. Inadequate circulation doesn't just affect one area. It compromises your entire vascular network. According to the American Heart Association, men over 65 face dramatically elevated risk for circulation-related conditions. 15% develop peripheral artery disease. 20% show signs of venous insufficiency. These conditions don't exist in isolation. When your legs aren't pumping blood efficiently, your cardiovascular system compensates by increasing pressure, which damages delicate blood vessels throughout your body. This information isn't meant to frighten you. It's meant to empower you. Ankle rotations combined with calf activation directly strengthen the muscular pumps that maintain healthy circulation. The movement stimulates blood flow dynamically, training your vessels to dilate and contract efficiently. You're enhancing the same vascular flexibility that medications try to force artificially. To perform this technique, sit on the edge of a chair with your feet hovering just above the floor. Rotate your right ankle slowly in a complete circle, moving through the full range of motion. Complete 10 circles clockwise, then 10 counterclockwise. Your calf muscles will engage to control the movement. Now, place both feet flat and perform 20 calf raises, lifting your heels as high as possible and lowering slowly. The deliberate pace is crucial. Quick, bouncing movements don't create the same muscular demand or circulatory stimulus. Slow, controlled rotations and raises force your muscles to work continuously, maximizing blood flow. Aim for 3 complete sequences. Ankle rotations followed by calf raises. Perform this routine daily, preferably in the morning to jumpstart your circulation. To increase difficulty, hold the raised position for 5 seconds instead of 2. You can also place a resistance band around your feet during rotations to add challenge. Urologists have observed that men who optimize lower body circulation before considering medications often find they need lower doses, or, in some cases, no pharmaceutical intervention at all. Their vascular system is already primed and responsive. This technique also improves overall stamina because efficient circulation means better oxygen delivery to tissues. Now, we're approaching the techniques that urologists like Dr. Bennett call essential for sustained male vitality. Exercise number 2. Glute bridge with pelvic tilt for core and hip stability. Everything related to male function requires hip strength and core stability. Achieving position, maintaining stamina, generating movement, all of these depend on the muscles of your posterior chain, specifically your gluteus maximus, hamstrings, and erector spinae. These are the muscles that prevent the rounded, weakened posture that diminishes so many older men's physical confidence. When your glutes and core weaken, your pelvis tilts forward. Your lower back compensates by curving excessively. This creates what physical therapists call anterior pelvic tilt. This misalignment isn't merely postural. It compresses nerves that supply your pelvic region. It restricts blood vessels that feed the erectile tissues. It creates chronic tension patterns that interfere with natural function. Medications do absolutely nothing for musculoskeletal alignment. You can take the strongest pharmaceutical available, But if your body mechanics are compromised, you're fighting an uphill battle. This is why so many men report that pills used to work better. Their underlying physical condition has deteriorated. A 2021 investigation from the American Journal of Men's Health followed 270 men through an 8-month training program. One group focused on cardiovascular activity alone. The other performed glute bridges and core stabilization work. At the study's conclusion, the bridge group showed an average improvement of 11% in rigidity scores. The cardio-only group showed minimal change. Additionally, the bridge group reported 58% reduction in lower back discomfort during intimacy. To perform glute bridges effectively, you need only your body weight and a yoga mat or carpet for comfort. Lie on your back with your knees bent and feet flat, positioned about hip-width apart. Your arms rest at your sides, palms down. Engage your core by gently drawing your navel toward your spine. Now press through your heels and lift your hips toward the ceiling, squeezing your glutes powerfully at the top. Your body should form a straight line from your shoulders through your hips to your knees. This is the neutral spine position you're aiming for. Hold this elevated position for 4 seconds, really focusing on the contraction in your buttocks and the stability in your core. Then lower your hips slowly back to the floor over a count of 4 seconds. Don't let gravity drop you. Control the descent. Perform 12 repetitions per set and complete 3 sets. The resistance level comes from your own body weight, but you can modify intensity by holding the top position longer or by elevating one foot slightly off the ground, forcing one glute to handle more load. If 12 repetitions feel too easy, use a resistance band looped just above your knees, forcing your hips to work against the band's tension as you lift. Bennett recommends this technique to patients recovering from prostate procedures because it rebuilds the muscular support structure that surgery often disrupts. Strong glutes and core act like scaffolding, holding your pelvis in optimal alignment and ensuring that nerves and vessels function without impediment. This brings us to the most critical technique of all, the one that urologists are prescribing more frequently than any other intervention. Exercise No. 1. Number 1. Progressive pelvic floor contractions with stamina training. If you implement only one practice for the rest of your life, this should be it. Pelvic floor training isn't just an exercise routine. It's a biomarker for male vitality. Researchers have discovered that your ability to control these muscles accurately predicts your functional capacity and satisfaction levels. A famous investigation published in the British Journal of Urology International followed more than 1,500 men over age 55 for an average of 5 years. Those who couldn't perform sustained pelvic floor contractions were 4 to 5 times more likely to develop significant dysfunction during the study period. 4 to 5 times. The pelvic floor contraction engages virtually every muscle group involved in male function simultaneously. Your bulbospongiosus compresses the base, forcing blood retention. Your ischiocavernosus stabilizes the structure. Your transverse perineal muscles support the entire mechanism. Your external sphincter provides neurological feedback. No other technique provides this comprehensive activation. And here's what makes it even more powerful. Pelvic floor training directly replicates the muscular control you need during intimacy. Every time you want to enhance sensation, prolong performance, or maximize rigidity, you're utilizing these exact muscles. By training this movement pattern specifically, you're not just building theoretical strength. You're building functional control that immediately transfers to real situations. The 2023 trial mentioned at the beginning of this presentation discovered that men over 70 who performed progressive pelvic floor protocols 4 times weekly increased tissue oxygenation by 26% in the erectile chambers. This is extraordinary because oxygen delivery typically decreases with age. The mechanical stimulus of repeated contractions sends signals to your vascular system that tell it to develop new capillaries. Better oxygen delivery means healthier tissue and stronger natural function. Urologists have begun prescribing this protocol as first-line intervention. They know that men with strong pelvic floors and good neuromuscular control have far superior outcomes compared to those relying solely on medications. Many specialists now require demonstrated pelvic floor competency before they'll even discuss pharmaceutical options. To perform this technique with maximum effectiveness, start in a comfortable seated position with your spine aligned naturally. Identify your pelvic floor muscles by imagining you're stopping urination midstream. That's the frontal portion. Now imagine you're preventing gas from escaping. That's the posterior portion. A complete pelvic floor contraction engages both simultaneously. Contract these muscles firmly, but not to the point of strain. You should feel a lifting sensation internally, as if you're drawing everything upward. Hold this contraction for 5 seconds initially, breathing normally throughout. Don't hold your breath. Then release completely for 5 seconds. That's 1 repetition. The key is the duration and quality of contraction. If you simply squeeze quickly and release, you're training fast twitch fibers, but neglecting the slow twitch endurance fibers that matter most for sustained function. Begin with 10 5-second holds if you're a beginner. Progress to 3 sets of 15 repetitions. Once that becomes manageable, extend the hold duration to 10 seconds, then 15. You can also incorporate intensity variation. Contract at 50% effort for 10 seconds, then increase to 100% effort for 5 seconds before releasing. Perform this protocol every other day to allow adequate recovery. Within 6 weeks, you'll notice that control and awareness have improved dramatically. You'll be able to engage specific portions of your pelvic floor independently, which provides incredible functional advantages. At the conclusion of our exploration, these 5 techniques represent what urologists like Dr. Bennett wish every man over 60 would implement. Medications have their place. Certainly, pharmaceutical science has helped millions. But if you want to address the root causes of decline, optimize your natural function, preserve your vascular health, and maintain the muscular control that creates genuine confidence, you need targeted training of the specific systems involved. The research is overwhelming. The medical community has reached consensus. Pelvic and circulatory exercises that challenge your muscles against resistance produce superior long-term outcomes compared to medications alone. You don't need expensive equipment. You don't need a gym membership. You don't even need to be particularly athletic. You just need privacy, perhaps a yoga mat, and 20 minutes 4 times per week. That modest investment of time can restore years of vitality and confidence to your life. Start with technique number 5 today. Master it over the next week, then incorporate number 4. Progress through the list at your own pace. By the time you reach the pelvic floor protocol, your body will be prepared for the challenge. Your future self will thank you for the strength and control you're building today. Now, we want to hear from you. Which of these 5 techniques are you most interested in trying first? Have you ever been told that pills are your only option after 60? Share your experiences and perspectives in the comments below. We genuinely want to hear from you. Before you go, let's address some frequently asked questions that Dr. Bennett encounters in his practice. First, how long before you see results? Most men notice improvements in awareness and control within 2 to 3 weeks. Measurable changes in function typically appear between 6 and 12 weeks, depending on your starting point and consistency. This isn't an overnight transformation. but it's a sustainable one that builds over time rather than diminishing like medication tolerance can. Second, can you do these techniques if you have prostate issues or have had surgery? In most cases, yes, but you must consult your urologist first. If you've had recent procedures, you'll need clearance before beginning any pelvic floor work. Dr. Bennett actually recommends these techniques to post-surgical patients specifically because they accelerate recovery. But timing matters. Your surgeon knows your individual situation and can guide you appropriately. Third, what if you can't feel your pelvic floor muscles initially? This is extremely common. Decades of disconnection mean many men have lost conscious awareness of this area. Start with the breathing technique, which helps establish that mind-body connection. You can also try stopping urination midstream once or twice to identify the sensation. But don't make this a regular practice, as it can create other issues. Some men benefit from working with a pelvic floor physical therapist initially to learn proper engagement. Fourth, will these techniques interfere with medications you're currently taking? Generally, no. These are natural, movement-based interventions that work through different mechanisms than pharmaceuticals. In fact, many men find they can reduce medication dosage as their natural function improves. However, never adjust prescribed medications without consulting your physician. The goal is collaborative care, where natural techniques and medical interventions work together. Fifth, what about diet and lifestyle factors? Exercise is just one piece of the puzzle. Dr. Bennett emphasizes that cardiovascular health is foundational. This means managing blood pressure, controlling blood sugar if you're diabetic, maintaining healthy cholesterol levels, and avoiding smoking absolutely. Nutrition matters enormously, particularly foods rich in nitrates like beets and leafy greens, which your body converts to nitric oxide. Adequate sleep is crucial because testosterone production happens primarily during deep sleep. Stress management techniques beyond breathing exercises, such as meditation or therapy, can be transformative. Everything connects. The philosophy Dr. Bennett shares with his patients is simple. Your body wants to function properly. Evolution designed these systems to work efficiently for decades. When they're not working, there's usually an identifiable reason: restricted blood flow, chronic tension, hormonal imbalance, neurological interference, or psychological barriers. Rather than just masking symptoms with chemicals, identify and address the underlying causes. Sometimes medications are necessary and appropriate, but they should be part of a comprehensive approach that includes movement, circulation, stress reduction, and lifestyle optimization. One patient story Dr. Bennett frequently shares involves a 68-year-old man who came to the clinic convinced he needed the strongest prescription available. He'd tried various medications with limited success and was frustrated and discouraged. Dr. Bennett conducted a thorough assessment and discovered the man had extremely poor lower body circulation, chronic pelvic floor tension, and unmanaged stress from a high-pressure career. Rather than immediately prescribing stronger medications, Dr. Bennett designed a 12-week program incorporating the exact techniques we've discussed today, plus dietary modifications and stress counseling. The patient was skeptical but agreed to try. Within 8 weeks, he reported improvements that surprised him. By 12 weeks, he'd regained function he hadn't experienced in over a decade. His circulation had improved so dramatically that his cardiologist commented on it. His chronic lower back pain had vanished. His sleep quality had improved, and his relationship with his wife had been revitalized. He still uses a low-dose medication occasionally, but he's no longer dependent on it. More importantly, he understands his body now. He knows what it needs and how to maintain it. This is the power of addressing root causes rather than just symptoms. This is what becomes possible when you take an active role in your health rather than passively accepting decline. You are not powerless. Age does bring changes, certainly, but many of the issues attributed to aging are actually due to disuse, neglect, and accumulated lifestyle factors that can be modified. Your body responds to the demands you place on it. If you demand nothing, it will atrophy. If you demand strength, circulation, and control, it will adapt accordingly. The techniques we've outlined today are based on peer-reviewed research, clinical experience spanning 3 decades, and the collective wisdom of urologists, physical therapists, and researchers worldwide. They're not fads or trends. They're evidence-based interventions that address fundamental physiology. The choice is yours. You can continue believing that decline is inevitable and medications are your only option. Or you can invest 20 minutes 4 times weekly into rebuilding the natural function your body is capable of. You can wait for problems to worsen, or you can take action today that prevents future difficulties. Dr. Bennett often tells his patients, "I can prescribe whatever you want, but I'd rather teach you how to not need the prescription." That's the philosophy guiding everything we've shared today. Empowerment through education, restoration through consistent practice, confidence through understanding your own physiology. This isn't about unrealistic expectations or miracle cures. It's about realistic, sustainable improvements that compound over time. It's about reclaiming agency over your body and your intimate life. We encourage you to start small. Choose one technique and practice it consistently for 2 weeks. Notice what changes. Notice what you become aware of. Then add another technique. Build gradually. Listen to your body. Adjust as needed. And most importantly, be patient with yourself. You didn't develop these issues overnight, and you won't resolve them overnight either. But with consistency and proper technique, you will see progress. That progress will motivate you to continue, and that continued practice will create lasting transformation. Thank you for investing this time in your health. Thank you for being willing to consider approaches that require effort, rather than just swallowing a pill. Your willingness to engage actively with your well-being is commendable. We hope this information serves you well. We hope it opens possibilities you didn't know existed. And we hope it contributes to a longer, healthier, more vibrant life filled with confidence and connection. Remember, this content is for general knowledge only. It does not replace evaluation by a qualified specialist. If you have questions or symptoms, consult your healthcare provider. Your individual situation may require personalized guidance that only a medical professional familiar with your history can provide.